Hello, everybody. Welcome to the Love Hour podcast. I'm your host, MrsKevOnStage, and I'm joined by my husband and co-host,
The Kev on Stage.
And listen, we are here with a very special episode. It's a little bit different than what we normally do. However, it is just as important because if you're in a relationship and you're doing a lot of the kissing, okay, and a lot of the other things that adults do, you got to make sure that your mouth is in order.
What that mouth do?
That is a really very, very important. And one of the first things, actually, one of the things that I find the most attractive about any human being is a smile. It's one of the first things that I was attracted to about Kevin because he has a beautiful smile. I don't even know how God gave him these perfectly straight teeth, and he's never done braces a day in his life.
Now I do Invisalign though.
Now you do Invisalign, but that's just like
bring my
perfect.
underbite over.
Yeah, they're just like perfecting your teeth. I feel like God just gave you really great teeth. And so with all of that said, we have a very special guest here with us today. His name is Dr.Maddahi. Go ahead and say hi to the people.
Hi, everybody. Thank you for having me on.
Thank you so much for joining us today. So we know, obviously, and we've all been taught some of the importance of oral hygiene and taking care of our mouth, although I find that not all of us understand the importance of oral hygiene. And I know they talk about how it's been linked to, I don't know, other things, although the connection never really makes sense to me in my mind, but that's what they say, child. And so we all know that it is really important, but I don't know that it's something that's harped on as much as it should be. I think we all get our hair done, we'll get our nails done, we'll get facials, we'll do all of those things like surrounding our face, but we don't actually take care of our mouth. So I think this is really important to understand the importance of taking care of our mouth. So can you tell us a little bit about you and your background and what you do?
Sure. First of all, my name is Dr. Maddahi. I have a practice in Beverly Hills. I've been in Beverly Hills for 33 years. And I'm
right down the
also
street from us.
Yes, I'm just around the corner. And I'm also the CEO and founder of Lumineux Oral Essentials, which is a non-toxic oral care product lines. It's very interesting that you bring up the whole concept of the connection between mouth, the oral health to whole body health. So I recently wrote a book called The Toxic Overload. And that comes from 20 years of research between this connection. So the connection seems to be confusing for many people. And I want to simplify this connection. And why does this connection actually exist? If you look at it, most infectious diseases actually enter your body through the mouth. The reason for that is you are touching things on different surfaces, and the bacteria and viruses are everywhere. The touching action and then eating food with your hands or touching your fingers with your mouth, these types of bacteria and viruses enter your mouth. Once it enters your mouth, it can easily get absorbed into your body. So a person who is going through a heart attack, the doctor tells the patient to put 2 nitroglycerin tablets underneath your tongue.
Okay.
Vitamin B12, you put under your tongue. That's how quickly things get absorbed into your body because of the tissues that are in your mouth. So it bypasses swallowing it, and it bypasses everything, and it gets directly into your bloodstream. Okay. We did a study recently with one of the mouthwashes that has a green dye in it and has alcohol. We had the patient rinse their mouth with the mouthwash. 60 seconds later, we did a blood test, and we found traces of the dye in their blood and the alcohol in their blood, even though they spit out the entirety of the mouthwash.
Wow.
So the rate of absorption of anything you put in your mouth going directly into your bloodstream is very rapid. So that's one. Number two is the origination of the point when you swallow. You chew things and you swallow it, right? So as you chew and you swallow it, there's other ways that this whole thing can get absorbed into your body. third thing, the actual connection comes from this. There is a connection between gum disease, which is an active bacterial infection in your mouth that is damaging your bone. There's been multiple research in the past 30 years that shows the direct relationship between gum disease, heart disease, diabetes, premature babies, Alzheimer, lung disease, colorectal cancer, and other things that are happening systemically in your body. So it's very, very important to get rid of this bacterial inflammation and infection that's in your mouth before it penetrates and spreads through your body.
So it's the bacteria in your mouth that's traveling to the rest of your body that's causing you to be more at risk or more prone to diabetes and all of these other things. Is that what you're saying?
Yeah, yes and no. The interesting part is that the bacteria, what it does, it causes inflammation. So there's inflammatory markers in the gums.
Okay.
Those inflammatory markers get passed through the bloodstream and goes to your heart. Those inflammatory markers are very much in common with the atherosclerosis, which is all of what happens inside the arteries of the heart. And also people that have asthma have these types of inflammatory markers as well. So these inflammatory markers is what causes the spread through the body.
Got it. Okay. That's interesting.
You talking about the wall of the heart, the thing you were saying?
Yeah, atherosclerosis, yes, that's right, the wall of the heart. The wall of the arteries that lead to the heart. So somebody who has a sort of a heart attack is mainly because inside the arteries, there's a clogging that's going on. And that clogging has been linked with people that also have gum disease. It's not the only factor.
Wow.
Is it I'm sorry, what was the last part you said?
It's not the only cause, but it's one of the contributing factors. So if you eat a lot of high-fat food, also contributes. So diet also plays a very important role with exactly what happens with the heart and your body as well.
So is it a one-to-one connection? Like if you have bad heart health, it'll show up in your gums, or if you have bad oral health, it will show up in your heart?
Yeah, so what has happened, in medicine, we only talk about risk factors, right? It's very difficult to anytime to 100% prove a one-to-one, right? So for years, as an example, people that were smokers, they couldn't show definitely smokers get lung disease, right? Because there were people that were not smokers that were getting lung disease. And then the whole concept of secondhand smoke came about, right? So the best way I can tell you is it rises the risk of heart disease by having gum disease.
Got it.
So it goes up by 30%.
The same way a smoker might not get lung cancer, but if you are a smoker, you are higher risk of getting lung cancer.
That's the way medicine and whole scientific community works in that sense. Exactly.
Got it. Okay. Got it. So I know that you also talk about, let me make sure I say it right now because I said it wrong earlier. Microbiome.
Yeah.
So can you explain to us what that is?
Right. So before I get into the microbiome, I want to tell you why I became so interested in finding why don't we get sick more often, or how did we survive from being in a cave all the way to where we are today. There was a time there were no medicine. There was quite a bit of bacteria and viruses. How did we survive all of these things? And why, especially now that we're going through the pandemic, it becomes very important. How did we survive other pandemics? What was it? What was the body doing
with the absence of modern medicine?
Before we had all of this medicine and everything else, right? So all of that research led to this concept. Our body has a first line of defense. And most people think it's our immune system. Immune system is a secondary line of defense. So the immune system gets kicked in when there's already infection or inflammation, not prior to inflammation and infection.
Makes sense.
Really?
Right? So yeah, that's
so what's
exactly
the first line
how
of
it
defense?
gets activated.
I think that's what he's saying.
First line of defense is the microbiome. So what is a microbiome?
Talking?
I'm going to tell you. So the microbiome there are microorganisms, right? Mainly bacteria that are in or on our body that protect us against disease and infection. Okay. So where is the microbiome? Where are they? First of all, the entirety of your skin is covered by microbiome. Your eyes are covered by microbiome. Inside your nose, there is microbiome. Inside your ears, there is microbiome. Inside your gut is microbiome. In the birth canal is a microbiome. So as a newborn is born, it gets coated by the microbiome.
Are these the same one?
Inside your mouth is the microbiome.
The same thing in every place?
Mostly same, not all the same, but mostly the same. But mainly made out of bacteria. Okay, so here is the easy way of understanding the protection that the microbiome provides us. Every day, you are dealing with pollution in the air, toxins in the air, all sorts of things that are in the air that are hitting your eyes. Why don't you get eye infection on a daily basis?
Because that microbiome is a protective layer.
That's right. That's right. Why don't you get ear infection often? Is the microbiome. Inside your gut, and I want to also tell you how important is bacteria to our body. First of all, there is 100 trillion bacteria in our body to 10 trillion human cells. Wow. So the number of bacteria to our own cells outnumbers 10 to 1.
Wow.
What is the bacteria? We cannot live without the bacteria, and they actually provide us with a very vital function. Vitamin K, which is the anticoagulation. The only reason why we don't bleed to death is because of vitamin K, and vitamin K is exclusively produced by the bacteria in our body. Serotonin and dopamine, how you feel, the mood neurotransmitters in your brain, is also stimulated or produced through the gut microbiome. Biotin, which is the health of your hair and your nail is dependent upon, is also produced by biotin, by the microbiome. So bacteria plays a very vital role in our body. So what has happened? Because we get infection and people died of infection, all of a sudden, everything got lumped into one. That all bacteria is bad. It's not true. It's only 2% of the bacteria that are harmful and cause severe types of infectious and diseases. 98% of the bacteria, only 2%. Only 2%.
That's really surprising because when I think of bacteria,
98%. Right, 98% are healthy, protective bacteria. So inside your mouth, you have 98% protective, healthy bacteria that protects you against disease and infection. What are we doing on a daily basis when we use antiseptic mouthwashes and antiseptic toothpaste? We destroy 99.9% of this bacteria that's in your mouth, which includes the 98% of the healthy bacteria.
Wow.
This is not good science. When we use hand sanitizers, we destroy 99.9% of the microbiome, healthy microbiome that is on our skin. And that is why we can have all sorts of skin problems if you're using hand sanitizers a lot.
Wait a second.
I knew I was going to wake you up with this one.
What?
Yes. Yes.
Talking. The CDC told me to use hand sanitizer in lieu of soap and water.
No, actually, no. What the CDC has said consistently is use soap and water.
Ah.
Now, the use of hand sanitizers is only if you do not have access to soap and water. If you work in a medical office, in our dental office, we use hand sanitizers. In the hospital, you use hand sanitizers. But at your home, you use soap and water. At work, you use soap and water. If you don't have access to soap and water, then you use hand sanitizers.
So what's happening is people are
use
using
of hand sanitizers is just destroying it.
Right. And they're using hand
Go ahead.
sanitizer 100% of the time, not using. And so
Yeah.
that's what's, we're overusing it.
Absolutely. So if you look at it, one of the things that I talk about in my book is starting in the 1950s, where antibiotics came into the world, right? 1950s, the rate of infectious disease started to go down. And then from 1950s, the rate of autoimmune disease has started to go up. And rate of autoimmune disease today is at the same height as infectious disease back in the 1950s.
Wow.
The main reason for this is because overuse of antibiotics, overuse of antimicrobial, antibacterial products. So I want to tell you how your body is exposed to antimicrobial ingredients daily, on a daily basis, multiple times a day. So we start with your mouthwash, toothpaste, or antimicrobial. Then if you eat meat, 98% of the meat has antibiotic in it, which is, again, kills the microbiome inside your mouth and inside your gut.
Wait. Are you, so you know how people always say that red meat is linked to cancers? Is this the reason why?
There are other reasons. There is no 100% link between antibiotic in the meat and cancer. Is not conclusive evidence. But again, the red meat, the fat in the red meat, the cholesterol, the antibiotic, the hormones, there's so many different things that are going on with the red meat now that it has made it so difficult to find exactly what is the contributory factor.
Got it. So a
That's
combination
why
of those
plant-based diets is becoming so popular, because at least there's no hormones and antibiotic, but the plant-based diets that have any pesticide is an antimicrobial, antibacterial product. So any non-organic food and vegetable also has antibiotic as well. It's antimicrobial.
Okay, so listen, hold on, doctor, hold on. Because what you just told me is that I need to grow my own food. That's what you just told me. But before we go a little bit further, let's take a break and hear a word from our Love Hour podcast sponsors. Okay, we're going to take a break from talking about our teeth and oral health to talk about your overall health that you need in your body. And we all know that the holidays are coming up. And the holidays aren't too kind to folks, okay?
Quarantine ain't been kind.
And you couple that with quarantine, and I know we're all out here looking at our bodies like, you know what? Let me get myself in order, okay? Well, I'm here to tell you that BeachBody can help you. They are the company behind P90X, Insanity, and 21 Day Fix.
So I do P90X. I do Insanity. I got my little space in my garage right behind Melissa's car. I be feeling like my own gym. I be in there musty and sweating. You don't need much space.
You don't need much
Insanity.
space.
You don't need much time either. You need I feel like Insanity, no thing goes over 30 minutes.
No.
You know, but they even have some that are 10 minutes.
Yes, they do.
I prefer Insanity myself because I love to just go crazy hard, for 30 minutes and then be like, whew, I'm done for the day. So they have ones that are 10 minutes, but I personally do Insanity Max 30. You push yourself to the max for 30 minutes a day, and it's legit. And they even have ones, usually a lot of these don't have any lifting ones, but now on BeachBody, they have Lift 4. It's a 4-day-a-week body shred. You got to have your own dumbbells and stuff, which I do have in my garage. And now you can lift as well because, I'm trying to be fit. Thin, but also beefy. You feel me? Cardiovascular, strong, but also like, hey man, he could beat me up.
And also, if you're out here and you're not trying to get super beefy, they have the morning meltdown 100. It's 100 days of, just leaning out your body, slimming down, which is really, really nice. Not as high impact as working out with Shaun T, but you still feel good and get your workout in order to get ahead of the holiday weight that you're going to get, because you don't want to sacrifice on the stuffing or the dressing. Argue in the comments with yourself which one it is. You get a special free trial membership. You're just going to text LOVE, that's LOVE, to 303030. You'll get full access to the entire platform, all workouts, nutrition information, and support absolutely free. Just text LOVE, that's LOVE, to 303030. Okay, so listen, doctor. I feel a little discouraged.
I just don't eat food anymore.
I know. I just feel like we shouldn't eat food anymore.
It's not true. So grass-fed, grass-fed beef that has no antibiotic, it's okay.
Okay.
Organic fruits and vegetables are okay. Go look at your dishwasher soap, washing machine soap, all of the cleaning products in your home. You don't want anything with an antimicrobial ingredient in it. Soap and water gets rid of bacteria and viruses. Soap and water takes care of them. You don't need all of these ingredients in the area. Wash your hands with soap and water and use certified non-toxic and also microbiome safe oral care products.
So if you use too much hand sanitizer and you need to recalibrate your hands, you just go put them in the dirt and be like, all right, skin, get your biome going back again.
Your microbiome.
As funny as that is, there's an actual interesting study. In Finland, they decided that they want to cut the rate of infection and disease. So there was a whole concept called the hygiene hypothesis. And the hygiene hypothesis was about how to create sterile environments so that you don't get sick, right? So hand sanitizer, sanitizing the countertops, all of the birth was through C-section, so the baby does not get exposed to the mother's microbiome. And what happened over the years, the rate of infection and disease went through the roof.
I was going to say, that sounds like it would have the opposite effect.
Yeah, the reason was our immune system, the immune system of the kids was never developed. Right. So playing in the dirt, what you just said, is the correct thing to do, because your body needs to be exposed to types of bacteria, especially as you're growing up. Our immune system, one of the reasons why there's an evolution in our immune system comes from viruses. Viruses help for your immune system to become stronger.
Right.
So we need to be exposed to viruses and bacteria so our immune system knows how to fight it. You cannot not expose the body and think you're going to be a strong body.
Makes sense. That's why we need to put our kids in daycare, because that's a petri dish for sickness.
Listen, you in daycare, your kid gets sick a lot, and then they be strong.
That's right. They get sick a lot, and then after a while, after 2 or 3 years, they stop getting sick. That's the reason.
I think that's the reason why I never get sick. I never, ever get sick, and I'm convinced I was just a snot-nosed kid that was always sick.
Our kids were in daycare, and they were snot-nosed McGee. And now our youngest son is like Melissa. He never, ever gets sick.
There you go. There is truth to this. There is truth to this. I want to validate it for sure. Yeah, so going back to the love hour and talking about kissing and fresh breath and everything else.
Eating coochie too. We need to talk about that. I need to know. I got a doctor on here. If your mouth health is all jacked up and you eat that coochie, you're going to mess up the vaginal health. pH balance is in the vaginal cavity. I need to know, doctor.
The first thing is to have a clean oral health, which means flossing, brushing, at least twice a year of cleaning is a key. And then more importantly, using, again, products that protects the oral microbiome so that your mouth continues to be healthy and it fights against these bacteria and viruses that are coming inside your body.
Mm-hmm.
So that's the parts.
I feel like you've actually just told us that there's a lot of commercialism in cleaning products and oral
That's
health
actually what I thought
that
too.
adds a lot of these things that we feel are necessary for things to get clean. That's actually not really necessary.
I've actually bought antimicrobial soap because I felt like that meant cleaner, and I didn't realize that it is cleaner, but that's not. There's a certain amount of dirty you need, I guess. I mean, those are probably not the right words.
You just don't need all the toxins that's included. I feel like whether you're cleaning your house or brushing your teeth, the more abrasive it is, you feel like it's doing the better job.
Yeah.
And sometimes it has a harmful effect.
Right.
Yeah, absolutely. That's the thing, because the marketing is so good that you feel like, oh, if it's also antimicrobial, the better it is, not knowing that our body is protected by this bacteria. And what we're doing, if we kill the good bacteria, all we're left with is the bad bacteria. That's
so
the
that
whole
cleaning
concept.
stuff doesn't kill the bad bacteria too. It just kills the good.
It's not targeted.
So what it does, here's an interesting thing. So how does the healthy bacteria protect you? Is imagine your mouth is covered and your skin is covered by the healthy bacteria. What that does, just the real estate that it's taking up, it doesn't let the bad bacteria to adhere and grow. In order for bacteria or viruses to grow, they have to adhere first, stick to it, and then they start growing. Okay. But once it is all covered by the good bacteria, there's no room for it to stick anywhere, to grow. So when we're destroying it, all you're doing is you're leaving these spaces, open spaces for these bad bacteria to stick and grow, number one. Number two, inside the microbiome, there is some low levels on unhealthy bacteria that's under control. And why that is there is because it helps the immune system to produce antibodies, so the body is ready always. So if any of these numbers go up, it already has the antibody to fight it. Makes sense. The microbiome takes up space and then works with your immune system to protect you.
That makes sense.
I get that.
Yeah, that makes sense to me. Your body's really a fascinating thing. And I feel like, again, through commercialism and advertising, you're almost not giving the body as much credit as it deserves. And so you overcompensate with all of these products that may really end up being unnecessary. Products that add a lot of things that are like stripping you of your good and your bad bacteria.
Exactly.
That's what I've heard a lot.
And I think,
go ahead.
and right now, besides the products, let's talk about what's also happening, what's relevant today in terms of wearing masks. And how is masks are causing also problems inside your mouth.
Oh, okay? Talk about it.
So let's talk about this for a second, because anytime your mouth gets dry, okay, so dry mouth, I want to talk about dry mouth and then I want to circle back to the mask.
Okay.
Dry mouth is caused by several factors. One factor is people that have allergies all the time that cannot breathe through their nose. They breathe through their mouth. As a result, they get dry mouth.
Makes sense.
People that have a deviated septum that cannot breathe through their nose, they get breathe through their mouth and they get dry mouth.
Okay.
People that are on medication. Now, interestingly enough, when you go to the CDC site and you look up dry mouth, it says antidepressants, anti-anxiety medication, heart medication, diabetic medication. There's 450 different types of medication that cause dry mouth as a side effect. Now, this dry mouth, what does it do? Saliva is also a first line of defense in your body. So what's inside your saliva, it also protects you against cavities and gum disease and everything else. When saliva goes down, the rate of cavity causing bacteria and the bacteria that causes bad breath goes up tremendously. Alcohol has a drying effect inside your mouth. One of the reasons that people that drink alcohol have bad breath is because of the drying effect of alcohol. Okay, so
I didn't know
now
that.
we take this,
it does dry out your
and
body.
we wear a mask. So when you wear a mask, one of the things that happens, your mouth also starts to become dry, especially if you're going up the stairs where there is more mouth breathing, your mouth becomes dry. So as a result, cavities go up. As a result, bad breath is happening. So what I am experiencing in my office is called masked mouth, because
wait, it's already been named.
Inflamed. Yeah, it's already been named. So is greater inflammation, greater bleeding, more bad breath, more cavities as a result of wearing masks at all times. So these are key important factors. Now, if you have dry mouth and you drink water, you make the dry mouth worse.
Oh,
and I
Lord.
want to explain this to you.
What?
Because saliva is what's important, not water. So if you already have dry mouth, that means reduced saliva. When you drink water, you dilute the little saliva you have, and it makes it even less.
That makes sense.
You need more saliva, not more water.
So how do you get more saliva?
What's interesting is because you feel like if you have dry mouth, you feel like that means I'm dehydrated.
Yeah.
So that's what you're trying to like replenish to produce the saliva. You're not realizing it's not doing that at all.
So he's going through bottles of water before my eyes. I'm talking to him.
They tell you to drink a gallon of water. I don't know what to believe. I'm more confused now than I've ever been.
Let me tell you something. There is nothing worse than where you say going up the stairs. Let me tell you what causes me to have dry mouth when I have a mask on. Walking through the grocery store, okay, and pushing a cart. I be huffing and puffing. Then as soon as you get to the line, you out of breath and you start coughing. Everybody looking at you like you got COVID. No, I can't breathe.
Oh my God.
Happens to me every single time.
Right. So the things that increases saliva, with the product line that I have, Lumineux, there is a hydrating mouthwash. Listen what's in it: grapeseed oil, coconut oil, and cayenne pepper oil. It increases the saliva flow in your mouth. Even if you take a lemon and you smell a lemon, your mouth starts to water. That's saliva that's being produced in your body rather than just drinking water after water. Now, if you are dehydrated, you need water. I'm talking about if you have dry mouth and you're drinking water. So these are two different things. We want to make sure the person is not suffering from dry mouth. How would you know you're suffering from dry mouth? If you get up in the middle of the night drinking water.
Oh no. Keep going. Give another one.
That's for sure.
Well, I have to self-diagnose myself.
and then drinking water all day long. You don't need to drink water all day long.
Dr.Maddahi, they done told us to drink a gallon of water every day and pee until your water is, the toilet doesn't even notice there's pee in there. Now you telling me no? I've been told y'all Dr. Pepper is fine. You can drink that. I thought you were supposed to drink 64 ounces of water a day.
No. So drinking water is good. Again, see what happens inside your mouth. Is your mouth feeling dry? Dehydration doesn't really have anything to do with having a dry mouth. Dehydration is a body thing, right? If your mouth is dry, is a different subject that we are talking about. So these are the kind of things we want to pay attention to. There is one thing you're drinking water because you want to be hydrated. The other thing, you're drinking water to keep your mouth constantly moist. If that's what's happening, you got to make sure you can breathe through your nose, you don't have allergies, and you're not taking any medication with a dry mouth side effect.
Got it. And so if, let's say you're taking medication and because you need to, you have to for your own, health or whatever have you, you're saying that the mouthwash that you have, this sounded like a Pinterest recipe, doctor.
Those
you
are all
said
natural
coconut
things.
oil, grapeseed oil, cayenne pepper.
Yeah. No, actually, if you look at it, all of the products that we use are certified non-toxic because there's no chemicals, there's no artificial coloring or flavoring, and there is nothing else but naturally derived ingredients in it. That's the whole purpose.
Actually, our dentist gave us our
Peppermint
mouthwash.
oil.
Yeah, our mouthwash is like mostly coconut oil
or coconut oil, but flavored as peppermint.
Yeah, it doesn't have any. And I didn't realize that's probably why it allows you to flush out your mouth, but not take away the natural microbiome in your teeth that you need.
It's actually more of a gum thing too. He's in Beverly Hills as well. I wonder if you guys know each
Beverly
other.
Hills be having a good dentist.
Yeah, our dentist is
top of the top.
Oh yeah.
Good. That's excellent. Yeah, so these are the kind of things. So for whitening, one of the other things that I did for whitening is because so many people, when they get whitening, they get sensitivity, mainly due to hydrogen peroxide. So tell me about your recent whitening experience.
Okay, before I do that, we're going to take a quick break, and then I'm going to tell you, Dr. Maddahi, because it was a doozy.
All right. We're taking another break to tell you about Thrive Market. Okay, what is Thrive Market? It is an online membership-based market on a mission to help healthy living easy and affordable for everyone. You guys know I have been a subscriber to Thrive. I got some seafood, and we did a little stay-at-home date night at the house, which was really nice.
With premium seafood,
With premium seafood. You may not want to go out, so you just stay in. You enjoy a really nice seafood. You know you're going to light some candles, set the mood, get a tablecloth
out. Get you some surf and surf.
Get you some surf and surf.
Yeah, doubling up on the surf.
Join today and you'll get a free gift of your choosing up to a $24 value. Free gift options for your audience are coconut oil. We all know coconut oil is God's oil. You can get cold brew. You can get a facial
oat
scrub.
Milk.
There's all types of options for you. So you definitely wanted to take advantage. Plus, they have really great savings. Thrive Market members save an average of $32 on every order. Go to thrivemarket.com/lovehour. Join today and you'll get a free gift of your choosing up to a $24 value. That's Thrive, THRIVE, market.com/lovehour to start your risk-free membership and get your free gift today. Again, thrivemarket.com/lovehour.
Love hour. Yeah.
Okay, we're back from our break. Thank you so much to our sponsor. So what happened was I was getting a cleaning.
Yep.
And they were like, hey, do you want a whitening? And I was like, sure. So they put a whitening gel on a tray. And it was like 3 different applications, I guess.
Cycles.
Cycles. Shout out to John McReynolds. Cycle 1, I'm fine. Cycle 2, I'm fine. Cycle 3, they're like, man, people usually don't go this far. And I'm like, yeah, man, I'm tough. Halfway through cycle 3, it felt like someone took a tiny drill and jammed it into my tooth. It's the feeling of like when cold wind gets on your teeth. So the first one, I'm like, oh, wow, that's really painful. But, we're almost done. After the first one, it was like one after another. So I'm like, okay, get this off me. They take the trays out. They give me some like little tray of like milky fluid, I guess. It's supposed to coat your teeth.
Fluoride.
Dr. Maddahi, for the rest of the day,
he was gone.
I was going into almost conniption fits of pain. It was like piercing, like someone jamming a knife into my gum.
It was terrible.
Then it would go away. I'd put the little coating on it, and there was no relief. I mean, even when I fell asleep, I would wake up with this and it was like not even the same.
Like electric shocks.
Electric shock. And it was like getting tased. I'm like, ugh, like squeezing my hands. It was the worst thing ever. And it took almost
3 days, 4 days.
Yeah. Well, at least the first day was the absolute worst, where it was like nonstop.
48 hours minimally. Yeah.
Yeah. By the second day, it was still happening, but not as often. It's not as intense. And probably by the third or fourth day, I didn't have any, or they would be like little tremors. But I told my dentist my teeth will be black before I ever do that again. It was the worst pain ever.
Yeah. So the main reason why you had the pain is because of hydrogen peroxide. So hydrogen peroxide has a whitening effect, but it also causes tooth sensitivity and gum irritation. It's mainly non-permanent, but if you look at it, the use of whitening products has gone through the roof at the same time as Starbucks became more and more popular. So the consumption of tea, coffee has gone through the roof. Whitening products went through the roof.
That's because all that coffee staying in our teeth, all
red
that tea.
wine.
Yeah.
Yeah, and yeah, you add red wine, blueberries, blackberries, green juice, red juice, soy sauce, barbecue sauce. There's constant staining of teeth that's going on. So people are using more whitening products than ever. So one of the things, being in Beverly Hills and having more and more patients experiencing sensitivity with their teeth, I started to research to develop a non-hydrogen peroxide whitening products. And instead of using hydrogen peroxide, I ended up using coconut oil, sage oil, and lemon peel oil on our whitening strip.
Lemon what oil?
Lemon peel.
Lemon peel oil. It's not acidic. Lemon peel oil.
Oh, peel oil.
We have independent university clinical research that we have gone head-to-head with leading brands that show that we whiten as well as them without hydrogen peroxide. So there's a whitening strip, whitening toothpaste, whitening mouthwash. You know, the name of the company again is Lumineux Oral Essentials, and there is whitening products, there's microbiome products. All of our products, of course, are microbiome safe, but people have sensitivity. The signature ingredient in all of our products is Dead Sea salt because it has such a high levels of mineral in that particular salt. So for sensitivity, we have something. For hydrating, for people that have dry mouth symptoms, we have something. For people that want whitening, we have something. And people that are after gum and tooth health, we also have something as well.
These are separate
and
products?
All of the research, they're separate products. And we have more than 51 clinical research that shows we are certified non-toxic. That shows that we whiten without sensitivity. And also we are microbiome safe. And all of this research you can find on our website called oralessentials.com.
So
that's oralessentials.com. Just want to make sure we got it out.
What, in your estimation, and feel free not to answer if you don't know or don't want to, why do you think there's such a proliferation of products, both dental and cleaning and hand soap that strip your body of this bacteria? If, you know, modern science, people know that you need such bacteria. You think it's just like a capitalism thing?
Yeah, so there's two folds to this. There's a marketing aspect for sure, but one of the things when we're talking about research, we know about microbiome, we know about healthy bacteria, we've known about it for a long time. Everything that I'm telling you is 100% known in the gut. Gut health has become such a key important part, and gut microbiome has become so important. But the problem was, the initial part of the problem is this: what causes cavity? Bacteria. What causes gum disease? Bacteria. What causes bad breath? Bacteria. So how do you get rid of it? So
get rid of the bacteria, all of it.
became get rid of the bacteria, but the problem was there's only a very small percentage that's harmful. The rest is healthy. How do you get rid of the harmful? The research that we have done, and has taken many, many years, it shows we don't kill any bacteria, we neutralize the toxin of harmful bacteria. The harmful bacteria, why they are bad is because they produce toxins, and these toxins is what is harmful to you. So what we have done is we neutralize the toxins of the harmful bacteria, but we don't kill any bacteria. That is something has not been found in other areas of cleaning products. But again, when we go to cleaning products, soap and water is good enough. You don't need anything else. So some of it is clever marketing, and some of it was the lack of research and a product that would neutralize the toxin of the harmful bacteria. That's the revolutionary aspect of our company.
Yeah, I feel like the other thing is what you're basically saying is we've taken a sledgehammer to a product that didn't need all of that force.
I'll show you bacteria.
Yeah,
ain't no bacteria no more.
Yes.
Good, bad, or indifferent. You're all dead.
And it just seems like an easier approach than, you've said this is taking you 20 years of research to find something that's a little bit more, it's effective, it's a more targeted, it's more precise. And it's just so much easier just to say, wipe it all out and figure it out after. And so they kind of make sense because that requires more money. And ain't nobody trying to spend the money on the research. We want to get something quick, fast, and in a hurry at the lowest price possible.
But you know what is interesting is that, again, going back to the love hour, we're talking about kissing, but you also want to have our loved ones for a long time.
Right.
So key to long life, longevity. So modern science is going to keep you alive for a long time, but what is the quality of your life? So if you truly want to have a long life and you truly want to have the quality of life that you can enjoy being together, enjoy your kids and your grandkids and everything else, you have to make changes that is within the diet, within the products, and within the lifestyle. So again, we're talking about products we've talked about. When we're talking about diet, we've talked about the more organic food and no antibiotic or hormones. In terms of lifestyle, again, smoking, vaping, smoking weed also causes dry mouth.
Smoking weed? I gotta stop smoking my weeds?
He doesn't smoke weed, cut it out.
I smoke some joints.
Yeah, so these are the kind of things. So people that are, because weed is becoming actually something that's legal in many states, you're gonna see the higher rate of dry mouth, you're gonna see a higher rate of cavities and more destruction of teeth that will impact the health of the person. So we are not really looking at the entirety of everything as to how to have a longer life, better life that is gonna be healthier as well. We have to take into consideration all these aspects.
All right, this might be a good place to take the last break.
Yeah.
Okay, listen, we've been talking real good stuff, and Kev's been asking some out-of-pocket questions about oral sex and all of the things, and we all know that as a woman, sometimes your pH balance ain't what it should be.
Right, girl. We be knowing, don't we?
After sexual intercourse, you could be peeing, you could be doing all the things correctly that you feel, and yet and still you find yourself with UTIs, bladder infections, any of those things. Well, I'm here to introduce to you Uqora. Okay, I actually was using Uqora before they were ever a sponsor on the podcast. And part of the reason why is because Jenna, who is the founder of Uqora back in 2014, used to get 8 UTIs a year.
That's a lot.
That's a lot. And if that sounds familiar and it resonates with you the way that it resonated with me, I was like, well, now listen now.
You're not alone, though.
I'm not alone. But if it worked for Jenna, it might work for me, okay? And that's what actually hit me to game to Uqora, because I was out here struggling, thinking I was doing all the things, and I just needed something to give me that additional support, and that's when I found Uqora. Even when you're doing everything right, some of us just need support, and that's when Uqora comes in. You're just going to take a mix of their packet, mix it into the water, stir it up, drink it, and that's it. It's easy, effective, and it tastes like pink lemonade. Uqora's unique drink mist flushes and cleanses the urinary tract and also boosts your immune system, which is especially important after sex, exercise, or other triggers. Okay, get proactive about your urinary tract health with Uqora right now, because being proactive is better than being reactive.
Yes.
Okay? If you do this on a daily basis, you're less likely to get the UTI to begin with because you're heading it off at the pass. Right now, Uqora is offering my listeners 30% off when you go to uqora.com/hour. But hurry, this is a limited time offer. Go to Uqora, that's UQORA.com/hour to get 30% off your order. All right. This has been actually a really enlightening conversation.
I agree wholeheartedly.
For me, I'm not quite, listen, let me check my
We didn't
notes,
talk
but I
about
feel
the oral
like,
sex yet, though.
well, ask him. Did you ask him?
If your teeth are jacked up, should you avoid oral sex? Because you can transfer bad bacteria to genitals. Will that cause long-term issues?
This will be the closing question, Dr. Maddahi. I apologize.
Yeah.
I need to know, Dr. Maddahi.
Yeah. So There is no study that has shown.
That's all you had to
This
say,
type of
doctor.
an
Thank you so
issue.
much.
But again, your mouth is a reservoir for bacteria and viruses, especially if you have gum disease. So it is definitely a way that you transmit it. So one thing I can tell you, I think in closing, which would be also very interesting, people that have dogs in their home, a lot of them complain of dogs having bad breath, dogs having gum disease, losing their teeth. If you look at it, dogs do not have these type of bacteria in their mouth. It is not native to them. It is transferred from humans to them. The reason why they have gum disease and bad breath is because of humans, not because of dogs.
Wow.
Dogs in nature do not suffer from these types of problems. So it goes back to show how you can transfer these types of things to other people or other even animals in your house.
Is that by like kissing them in the mouth or by like sharing food?
Yeah, sharing food, kissing, absolutely. Absolutely.
So we done gave gum disease to dogs when they don't even be having that?
Messed up all the
That's
dogs.
right. That's right.
What?
If you look at huskies in like in the North Pole, they usually live up to age 22. When you have them as a domesticated animal, they mainly live up to 10 to 12 years of age, and they get all sorts of diseases, and which is all because they are at home, not to do with anything to nature.
Humans are trash.
So that was a good wake-up call for everybody.
Yeah,
man, leave them dogs alone. They'd be living way longer out there in the wild.
Humans suck for real.
You over here giving them half a peanut butter sandwich, and now they got all type of diseases.
Well, listen, this again has been a really enlightening conversation. Dr. Maddahi, I would love for you to leave the people with additional information as far as where they can contact you, of course, your website again, and your products.
Yeah, so for my own office website is drmaddahi.com. For the products is oralessentials.com, where we are also in Walgreens, Whole Foods, Wegman. If you go on the website and you do a store locator, we're in more than 4,500 stores all across the United States.
Wow.
We're also on Amazon. They can also purchase the products and read about it on our website and get better understanding of the microbiome.
Oh, that's fantastic. So that's oralessentials.com. But listen, he is also in tons of stores.
I didn't realize that.
Yeah.
Wegmans isn't even around here. So that means you're more than the West Coast. Wegmans is in New York?
So in New York, all across New York, Wegman is, that's where most of the Wegman, there's about 100 stores that are all in New York area. And also the book that talks about the connection between oral health, whole body health, talks about microbiome, I came up with the recipes for people, what they can eat for breakfast, lunch, dinner, all sorts of things that would be microbiome safe. Is a toxic overload, which they can find it on Amazon, on Kindle, and also in Audible as well.
I think that's fantastic. I think a lot of people these days are more aware of what they're putting in their body, the products that they're using, whether that's lotion or deodorant or perfume. We're all aware of the harmful toxins. And so anything we can do to prevent ourselves from being exposed to those types of things, I think the better off we'll be in the long run. So thank you so much, Dr. Maddahi. Kevin, do you have any last words?
No, this was really enlightening. I'm going to go outside and put my hands in the dirt and then wash them with soap and water.
Soap and water.
A friend of ours actually had a hand issue because she was using too much. She was just using hand soap.
It was your sister.
Well, I wasn't trying to say that.
Oh, I just want to be sure it wasn't a friend, but keep going.
She was just using hand sanitizer all the time because she'd watching a lot of news. She's like, want to be cool. And then the doctor's like, you've been overdoing it. Yeah. It's actually, you're robbing your skin of its natural bacteria. Soap and water is fine. So yeah, I've learned a lot of stuff. Thank you so much for sharing with us. And actually, it's good to know some of the stuff we were doing was right, like the right mouthwash and stuff. I haven't used that. I wasn't doing any of this on purpose. I just hadn't sought out antimicrobial soap in a while. And now I'm realizing that was a good thing on me. So shouts to me.
All right.
Thank you so much. Thank you for both of you for a great time. I really enjoyed myself.
I did too.
And thank you for everything that you do and bring all this nice and great information to your listeners.
Thank you so much, Doctor. Have a great day.
You too.
All right. Until the next Love Hour episode. Bye.
Bye.